If you're over 50 and you're urinating more frequently than you used to, I want you to know something right away. This isn't your fault. Urinary changes after 50 are extremely common, and they're biologically driven. Over 50% of men over 60 experience symptoms related to benign prostatic hyperplasia, or BPH. That's just prostate enlargement. It's not cancer, it's not a disease. It's a normal part of aging for most men. But knowing it's common doesn't make it any less frustrating, does it? I see men in my practice who've started blaming themselves. They think maybe they're drinking too much water, or maybe they're drinking it at the wrong times. And yes, hydration timing matters, but it's not the whole story. Here's what I tell them. Stop blaming hydration alone. Patterns matter way more than volume. If you're getting up once or twice a night and you feel fine during the day, that's one thing. But if you're waking up 3, 4, 5 times a night, struggling with weak flow, feeling like you can never fully empty your bladder, that's a pattern worth paying attention to. But what's really happening inside the prostate may surprise you. Let me tell you about the quiet frustration men rarely talk about. Frequent nighttime urination and weak flow don't just affect those few minutes in the bathroom. They quietly erode your confidence. They destroy your sleep. And when your sleep suffers, everything else suffers too. Your energy, your mood, your ability to focus, even your relationship with your partner.
I had a patient, mid-60s, who came in looking absolutely exhausted. He told me he was waking up 3 to 4 times every single night to urinate. He felt embarrassed about it. His wife would ask if he was okay, and he'd just brush it off. But inside, he was frustrated. He felt old. He felt like his body was failing him. And here's the thing. He thought it was just something he had to live with, that this was just part of getting older and there was nothing he could do about it. But that's not true. And I need you to hear this clearly. There are things you can do. First step, track your nighttime bathroom trips for 7 days. Write it down. How many times are you getting up? What time are you going to bed? What time is your last drink of the evening? This becomes your baseline because you can't improve what you're not measuring. Now, here's something that surprises a lot of men. Prostate size isn't always the real culprit. You'd think bigger prostate equals worse symptoms, right? But that's not how it works. Symptoms often come from inflammation and muscle tension, not size alone. I've seen men with moderate enlargement who feel absolutely miserable, and I've seen men with significantly larger prostates who barely notice any symptoms at all. The difference? It's not about how big the prostate is, it's about how irritated it is, how inflamed the tissue is, how tight the smooth muscle around the bladder neck has become. So instead of obsessing over shrinking the gland, which can take months or even years with medication, focus on reducing irritation, reduce inflammation, support the systems that control muscle tension and urinary flow. That's where you'll see improvements much faster. Here's the physiology most men never hear explained. Let me walk you through why symptoms actually worsen at night, because understanding this changes how you approach the problem. During the day, when you're upright and moving around, gravity helps. Fluids are distributed throughout your body. But when you lie down at night, those fluids redistribute. They move toward your core. Blood volume increases in your central circulation. And that puts more pressure on your bladder. On top of that, certain hormones shift at night. Your nervous system tone changes. The muscles around your bladder and prostate can become more reactive. So even if your bladder isn't completely full, it feels like it is. You get that urgent signal to go, even when there's not much there. This is why front-loading your hydration earlier in the day makes such a big difference. You're staying hydrated when your body can handle it better, and you're reducing the fluid load at night when your system is already more sensitive. Now let's talk about what actually drives prostate symptoms in the first place. There are 3 main drivers: inflammation, smooth muscle tension, and hormonal sensitivity, and they all work together. Let's start with hormones. As you age, testosterone converts into something called DHT, or dihydrotestosterone. DHT is a more potent form of testosterone, and it has a strong effect on prostate tissue. It doesn't just cause the prostate to enlarge, it also increases the reactivity of the tissue. It makes the gland more sensitive to irritation, more prone to inflammation. But here's what's important. Anything that reduces inflammation in your body can reduce symptoms in your prostate, because inflammation is a huge part of this equation, which is why medication doesn't always fully fix the problem. You can take a medication that shrinks the prostate or relaxes the muscles, and yes, that helps. But if you're still dealing with chronic inflammation from your diet, from stress, from poor sleep, you're not addressing the root cause. You're just managing one piece of it. So let me explain the role of inflammation in BPH. Chronic, low-grade inflammation irritates the prostate and the bladder neck, and studies have actually linked inflammatory markers in the blood to worse urinary flow. The more inflamed your system is overall, the more symptomatic your prostate tends to be. What drives inflammation? A lot of things. High sugar intake, excessive alcohol, especially in the evening, heavy meals late at night that stress your digestive system, lack of movement, poor sleep. All of these things contribute to an inflammatory state in your body. And when your body is inflamed, your prostate feels it. The tissue becomes more swollen, more irritated, more reactive, and that translates directly into symptoms: urgency, frequency, weak stream. The fix? Reduce sugar. Cut back on alcohol, especially after dinner. Avoid late-night heavy meals. These aren't drastic changes, but they make a real difference. But there's another overlooked factor that I need to talk about: smooth muscle tension. This is the hidden blockage that most men don't even know exists. Around your bladder outlet, there's smooth muscle. When that muscle is relaxed, urine flows freely. But when it's tight, when it's in a state of tension, it restricts the opening. It's like trying to pour water through a hose that's partially kinked. The pressure is there, but the flow is weak. This is actually why alpha blocker medications work. Drugs like tamsulosin, they don't shrink the prostate. What they do is relax the smooth muscle around the bladder neck and the prostate. And when that muscle relaxes, flow improves almost immediately. But here's the interesting part. Nutrients and timing can support natural relaxation too. You don't necessarily need a medication to help that muscle function better. Certain compounds in food, certain patterns of eating and hydration, they can influence muscle tone in a positive way. And this is where a simple drink can actually play a role. Now, let me be very clear about why nutrition can influence prostate comfort. We're not talking about a cure here, we're talking about support, about creating conditions in your body that reduce irritation and improve function. Certain nutrients have been studied for their effects on prostate health. Lycopene, which is found in tomatoes and watermelon, has anti-inflammatory properties. Zinc supports prostate tissue health. Beta-sitosterol, a plant compound, has been shown in studies to improve urinary flow and reduce symptoms. These aren't magic bullets, but when taken consistently, not sporadically, they support the anti-inflammatory pathways in your body. They help reduce the reactivity of prostate tissue. They create an environment where symptoms are less severe. Food works best when it's part of your daily routine, not something you do once in a while when you remember, not something you try for 3 days and then give up on. But most men use these completely wrong, and that brings me to the mistakes I see all the time in my practice. Because even when men are trying to do the right thing, they're often sabotaging themselves without realizing it. The first mistake? Drinking healthy fluids too late in the day. I cannot tell you how many patients have told me, "Doc, I switched to herbal tea in the evening. I'm trying to be healthier." And I have to tell them, that's actually making your nighttime urination worse. Evening fluids worsen nocturia regardless of how healthy they are. It doesn't matter if it's water, herbal tea, or a nutrient-packed smoothie. If you're drinking it 2 hours before bed, you're going to be up at night. Even herbal teas, which people think are harmless, stimulate bladder activity when consumed late. The fix is simple. Stop fluids 2 to 3 hours before bed. Front-load your hydration during the day. Drink plenty in the morning and afternoon, but taper off as evening approaches. The next mistake happens during the day, and it's just as common: expecting supplements to work alone. Men will come to me and say, I'm taking saw palmetto every day, but I'm still having symptoms. And when I ask about their diet, their hydration timing, their evening routine, it's a mess. No ingredient, no supplement can override poor habits. If you're taking a prostate supplement, but you're still drinking 3 beers every night, eating a heavy dinner at 9 p.m., and chugging water right before bed, the supplement isn't going to save you. Patients on saw palmetto still struggle when they don't address the diet triggers and timing issues that are making their symptoms worse. The fix? Pair nutrition with timing and smart food choices. The supplement supports you, but you have to support it too by creating the right conditions in your body. Now let's talk about the drink itself. So, what is this homemade drink and what does it actually support? First, let me be very clear about what it is and what it isn't. This drink supports inflammation balance and urinary comfort. It's not a cure. It's not going to reverse 20 years of prostate enlargement overnight. But when used consistently as part of a broader routine, it can help reduce symptoms and improve how you feel day to day. Here's a simple blend concept that incorporates the nutrients we talked about. You start with a tomato or watermelon base. Both are rich in lycopene, that anti-inflammatory compound that supports prostate tissue health. You add a small amount of fresh ginger or turmeric for additional anti-inflammatory benefits. And you mix it with water. No sugar, no juice concentrates, no sweeteners that are going to spike your insulin and increase inflammation. That's it. Simple, clean, functional. Now, timing is critical. You consume this earlier in the day, ideally 4 to 6 hours before bedtime. You want the nutrients working for you during your active hours, not creating more bathroom trips at night. A lot of my patients will have this with lunch or as a mid-afternoon drink. It becomes part of their routine. They're hydrating, they're getting beneficial nutrients, and they're doing it at a time that doesn't interfere with their sleep. But even this can backfire if you use it incorrectly. And that brings me to mistake number 3, expecting rapid results. Prostate tissue responds slowly. It's not like taking a pain reliever where you feel better in 30 minutes. The prostate is a gland. It has a specific cellular structure. Inflammation doesn't resolve overnight. Tissue reactivity doesn't change in a few days. Most of my patients notice changes in 3 to 6 weeks, not days. And that's actually a good sign, because when changes happen that quickly with something natural, it usually means they're temporary. But when improvements build gradually over weeks, they tend to last. The fix? Measure your progress weekly, not daily. Track how many times you're getting up at night. Track your urinary flow. Track your sense of urgency during the day. Look at the trends over time, not the day-to-day fluctuations. So how do you actually implement this safely and effectively? Let me give you a prostate-friendly daily routine that's simple and repeatable. Because complicated routines don't get followed. And if you don't follow it, it doesn't work. Here's the structure. Morning hydration, midday nutrition, evening reduction. You wake up, drink a glass of water. Rehydrate after sleep. Maybe have your coffee if that's part of your routine. Then throughout the morning and into the afternoon, you're drinking normally, staying hydrated, keeping your system functioning well. Around lunch or early afternoon, that's when you have your prostate support drink, the tomato or watermelon blend with ginger or turmeric. You're getting your nutrients at a time when your body can use them effectively. And then, as evening approaches, you start reducing fluid intake. You have a light dinner, nothing too heavy or inflammatory, and you stop drinking fluids about 2 to 3 hours before bed. This is the routine. It's not complicated, but it works because it addresses all 3 key factors: inflammation, hydration timing, and nutrient support. The key is to anchor the drink to lunch, not dinner. When you tie it to a meal you're already eating, it becomes automatic. You don't have to think about it or remember to do it. It just becomes part of how you eat. Now, here's what my patients notice first when they start doing this consistently. The early signs that it's working are subtle before they become obvious. You're not going to wake up one morning and suddenly feel 20 years younger. That's not how this works. But within the first couple of weeks, you might notice you're getting up one less time at night. Or maybe you're still getting up the same number of times, but the urgency isn't as intense. You don't have that panicked feeling of, I need to go right now or I'm not going to make it. Your stream might get a little stronger, not dramatically at first, but noticeably. You're not standing there for 2 minutes waiting for things to get started. The flow comes easier, empties more completely. And then over the next few weeks, those improvements continue to build. Fewer nighttime trips, stronger flow, less urgency during the day. You're not constantly scanning for where the nearest bathroom is when you're out running errands. My advice? Track your bathroom trips and urgency levels. Keep a simple log for a few weeks. You'll be able to see the patterns more clearly than if you're just trying to remember how you felt. And this goes beyond just the prostate. Because here's what I need you to understand why this is really about quality of life, not just urination. When you're not getting up 4 times a night to use the bathroom, you sleep better. And when you sleep better, everything improves. Your energy during the day, your mood, your ability to handle stress, your patience with the people around you, even your intimacy with your partner. Many of the men I work with tell me they feel younger simply by sleeping through the night. They wake up refreshed instead of exhausted. They have the energy to do things they'd stopped doing because they were just too tired. Better sleep improves cognitive function. It helps your body recover, it supports your immune system, it regulates your hormones. All of this from something as simple as reducing how often you're waking up at night. So, yes, we're addressing prostate symptoms, but really, we're addressing quality of life. We're giving you back the sleep and the confidence and the energy that you thought you'd lost for good. This is why I tell my patients treat sleep as part of prostate care. Because when your sleep improves, your body can heal better. Inflammation goes down, stress hormones normalize, everything works better when you're well rested. Here's what I want you to remember. Prostate symptoms are manageable. They're not something you just have to suffer through in silence, and they're definitely not something to be ashamed of. This is a normal part of aging for most men, but normal doesn't mean you can't improve it. Small, daily changes outperform aggressive short-term fixes every single time. I've seen men try every supplement on the market, jumping from one thing to another, hoping for a miracle, and they get nowhere. But the men who commit to simple, consistent habits, they're the ones who see real improvements. They're the ones who come back to my office and tell me, "Doc, I'm sleeping through the night now. I feel like myself again." So start with one habit this week, just one. Maybe it's stopping fluids 3 hours before bed. Maybe it's making that simple anti-inflammatory drink with lunch. Maybe it's cutting out the evening beers that you know are making things worse. Pick one thing, do it consistently, and then add another habit the following week. Because this isn't about perfection, it's about progress. It's about supporting your body in small, sustainable ways that actually add up to real change. This isn't about curing your prostate. It's about supporting your body so it can function more comfortably for years to come. Your prostate is going to continue to age. That's just biology. But how symptomatic it is, how much it interferes with your daily life, that's something you have significant control over. And I want you to know that you're not powerless here. You're not at the mercy of your body. You have tools, you have strategies, you have the ability to make meaningful changes that improve how you feel every single day. If this information was helpful to you, if it gave you a clearer understanding of what's actually happening and what you can do about it, I'd really encourage you to subscribe. I share evidence-based guidance on men's health because I believe you deserve real information, not just marketing promises or fear tactics. You deserve to understand your body. You deserve to know what actually works and what's just hype. And you deserve to age with dignity and comfort and confidence. Take care of yourself. Your body is still capable of functioning well. You just need to give it the right support at the right times. And when you do that consistently, you'll be surprised at how much better you can feel. The next mistake happens during the day, and it's just as common. Expecting supplements to work alone. Men will come to me and say, "I'm taking saw palmetto every day, but I'm still having symptoms." And when I ask about their diet, their hydration timing, their evening routine, it's a mess. No ingredient, no supplement can override poor habits. If you're taking a prostate supplement, but you're still drinking 3 beers every night, eating a heavy dinner at 9 p.m., and chugging water right before bed, the supplement isn't going to save you. Patients on saw palmetto still struggle when they don't address the diet triggers and timing issues that are making their symptoms worse. The fix? Pair nutrition with timing and smart food choices. The supplement supports you, but you have to support it too by creating the right conditions in your body. Now let's talk about the drink itself.